by way of introduction, we have a pattern here, as many of you know. More than 70% of our practice has this constellation of immune, connective tissue, and neurovascular differences that are resulting in significant disability. And while we knew about like the co-occurrence of things like dysautonomia, hypermobility spectrum conditions, we knew about this as it relates to neurodivergence. It's in the literature. We really did not expect the pattern to be so striking and so widespread. And in fact, and it's been a few months since we've updated our internal QI data, but like 95% of our neurodivergent patients has this particular presentation. So even when we look at this subpopulation of autistic patients, for example, average life expectancy, 36 to 54 years. That is striking, because not dying from autism, dying from premature cardiovascular disease and suicide. And like, we are trying to take on support for mental health as like a prime thing of what we do here at All Brains Belong. But the cardiovascular disease, we have to address that too if we want people to not die between age 36 and 54 years. I'm 38 years old. And really what I think what this comes down to is that the healthcare system is missing something huge about neurodivergent physiology. But first, I'll just share with you that we know that neurodivergent people have lots of co-occurring conditions, you know, and even with doctors who are trained in taking like more advanced training of supporting autistic ADHD patients, this is like memorized as a list, not necessarily zooming out and looking at like why are all these things, like is it just like complete random? That's how it's presented, but I don't think that that's what this is, because there's literature that links all of those things to each other and links them to autism and most of these things to ADHD specifically, but again, huge co-occurrence there. Almost this population here at All Brains Belong, where people come here because their needs are not met by the traditional healthcare system. They may or may not recognize them or identify themselves as neurodivergent, but they come in like not the top down, like you know that they have this diagnosis and you think about the co-occurring things to screen for. Think about, they don't come in that way. The script gets flipped, where they come in from the bottom up. Like, so what we're seeing here is that the overwhelming majority of our patients here, so 70% of our whole practice, 95% of our neurodivergent patients are having something in this allergy/immunology bucket, something in the sleep bucket, something in the gastrointestinal bucket. In the neurologic bucket, you know, not just brain, but the whole nervous system, because the nervous system goes through the whole body, and connective tissue and nerves, blood vessels. And this is how people are coming in. And they said, well, you know, my doctors never have really kind of found why I feel so terrible, and like, help me not feel so terrible. That's how they come in. So when you zoom way out, and one of my patients came, because a lot of times what this is about is it's giving patients a unified narrative for understanding their whole lives, that you don't have 40 things wrong with you. You have one pattern. And not only is it a way of understanding your health, but it influences management too. And very commonly in the medical system, there's management strategies that are end up impacting the other parts. For example, if somebody has chronic pain, they often get put on muscle relaxants, which if they also have sleep apnea, because connective tissue is collapsing on itself in the airway, that's going to make this worse. And then you're going to have more hypoxia, which then makes your blood vessels tighter, which then like, it's just, it all disintegrates from there. Or compression garments, which are standard management for dysautonomia. If you're also having, you know, Raynaud's or constricted blood vessels for some other reason, compression makes that worse. And so it's very, very complicated, these kind of internal conflicting access needs.